Okay, this is part of the ugly side of nursing series that I'm going to be shooting. Um, there was a commentary on another video. I might link it or not. It's nothing against the the shooter of it, the shooter, the creator of the content. I guess that's the correct verbiage. Um, she's a new L&D nurse, and she made a comment that I just thought about. I was like, she's very cheery side. Don't get me wrong. There's trying to present a cheery side of nursing. Not no. I don't want to say it that way. She wasn't like like oh rainbows and whatever, like register RN. She's always very peppy, and that's fine. She's an educator. All educators should be that way. The educators aren't. They're like, you should move on because you don't like that position. Get out. It's just you might do a good job at it, but you gotta be a little more effusive, right? So this content creator is shooting her experience, her valid video about her entry into nursing, and she made a comment that it'll all work out. It's all good and whatever. It's nice. Just hang in there. And to some degree, she's correct. To some degree, she's not correct. Okay. And what I mean by that is there are times when it doesn't get nice. And it gets very, very, very ugly. And very, very sad. Especially in L&D. So that's why I was like, wow, okay, you haven't had a bad delivery yet. It can get very nasty. It can get very crazy. Because it's not just professionals standing there. It's one thing if it's the code team, a resident or a CCRN, whoever is running the code, and it's moving like clockwork. And when codes are done right, they have a pretty decent chance of success. I don't know if people realize, it's not like Hollywood. 90% of codes end badly, I believe. I think that's, or at least the end result, like, it's not a good outcome. Maybe it's like a day later or 2 days later, but it's whatever. But I think it's even taking that factor out, I think it's like majority of them don't end well. Okay, so it's not like Hollywood. You usually do not get the patient back. So even then, it's professionals. We're all doing it. We're doing your job. They tell you to do that because then it's easy. In L&D, you're going to have family. You're going to have a screaming, sometimes, patient and another patient on the way. And I don't want to scare any L&D nurses or NICU nurses or PICU nurses. Don't get me wrong. We need more of them. We need more and more of them. It's not less and less of them. So there are many, the overwhelming majority will be great stories. Don't get me wrong. So let me preface that. Okay, I don't mean to scare anybody off. But be aware that it is a very ugly side to that. And I mean, besides the emotional aspect, I can get into that. That's a whole nother story. A whole nother video maybe. But not every patient makes it. Okay, and that's a difficult thing to grapple with. I remember one of my early work dates is I just interacting, meeting up with my girlfriend, she's in NICU research now, but she was in NICU proper for like 16 years. And, one of our first work dates, we just meet up before work, just, chit chat, have coffee or something like that. If she had the rare break or something like that. And, it involved me helping her carry a baby casket around the hospital. She had to take it to another unit. Just the basket, just the casket, and they have actually kits, okay? Like you have an intubation kit, you have a welcome kit, you have a postmortem kit. This is what you do, because guess what? In ICU, people pass on. L&D, it happens, and that's a very ugly side. And maybe if it's spoken about, like suicide or whatever, that you guys, people going into the field are better prepared for it, rather than, oh, it's all happy, happy, happy. Oh my effing Lord. Because that's as black and white as you can get. That's white, fluffy rainbows, and then Manta black. Or Vanta black. It's Vanta black, I believe. The ultimate darkness, because that's what you're gonna see. That's a reality of things. When you keep kits of this, expect it to happen. You hope it doesn't, but expect it does. All right, so that's something that it just it just stopped me in my tracks, because I was like, what? And that's good that she still has a great outlook, but be aware that there's an ugly side to nursing, and we have to be there, and we have to put our feelings aside. You have to be there for the mom, the baby, the family, whoever's the surviving parties involved, or the traumas that are involved, because you never know what's going to happen. I mean, you guys know you guys can Google up whatever's happening in the world, and there's always tragedies, like, what's in my mind. I'm not going to voice it out, but that happens, so be aware that you're not removed from the situation. You have to remove yourself from your feelings from this situation, but you're right there in the thick of it, and you're that level provider, okay? Because very often, sometimes the actual provider kind of walks away, and you're there literally cleaning up, quote unquote, the mess. You're gonna be the person there for hours afterwards, especially in LMD, because you're 1-to-1 basically, or the most 2-to-1, and eventually even the 1-to-1s become 2-to-1, okay? Because you get 2 patients and then transfer them up to maternity, mother baby, that you're going to be the one holding the person's hands. You're the one comforting the family. It's a very ugly side. Some people are built for that, and that's great. That's I thrive for that in some degree. You're not going to thrive. Nobody thrives in that. Priests don't thrive on helping people mourn. They're good at it. Funeral directors, the good ones, are good at that, but they don't thrive on it. You can just do as you can. It's a very ugly side. Okay, just be aware of that. Just so you're going in. I still encourage anybody who's going into those fields to go into that field. Please don't avoid it because of what I just said. Okay, good luck.